Hello, I'm Carolyn Jones with Washington's Children's Administration. Welcome to this workshop on the web. Dinah Martin is in the house today to help us understand the effects of multiple placements and what that does to children and their ability to trust and bond. Dinah has more than a quarter of a century of experience in working with at-risk children and families with our agency and is also an adjunct member of the Pierce College faculty. Most importantly, Dinah has been a foster parent herself and knows firsthand the importance of permanency for children. As always, we won't go without telling you how important you are to the children that you serve. Thanks for all you do, and enjoy the workshop.
Let's start by just talking a little bit about history and how we got where we are and why we do what we do. The discipline of child welfare is actually pretty new, and the structure around there being a formal child protective services, child welfare, foster care program is also fairly new. DSHS as an agency has only existed since 1970. And probably, there certainly have been throughout history a variety of ways that people chose to intervene in families' lives. Mostly it was an informal kind of process. The first time there was any legal process that came about in terms of child welfare, it was actually imposed under animal welfare laws because there were no child protection laws. But starting back in probably the early to mid part of the last century, the 1900s, people became more aware, and in the 60s and 70s is when it actually became a formal structure around child welfare. I brought a variety of paper for you today that's related to the laws. Now this is the boring thing because I think that most of you probably don't care at all about the laws. But I think that it is helpful for you to understand how things kind of all fit together. What we do and how we do it mostly is regulated by the federal government. There are state laws and there are federal laws. Our state laws are mostly more specific around program things, but the federal laws are the big pieces that tell us how and when to do our work. Probably the first part of the laws that formally created some structure around foster care came about as a part of CAPTA. That stands for Child Abuse Prevention and Treatment Act. And that was in the 1970s. So that's not so terribly long ago, was it? Anybody who wasn't here in the 1970s? See, you've all lived through this. And the purpose of this law was to create some structure around the programs and to provide federal funding to the states. That law has been renewed at various times throughout the years, tweaked to meet the, as needs changed. But mostly it provides some structure to how we get our federal funding. And currently we have grants. There are grants that come from the federal government to the state that helps to create innovative programs and things like that in states that states have to actually propose, and it needs to be approved by the federal government. So that was originally in 1974. The next piece of law that you may be interested in is the Indian Child Welfare Act. Now, I'm talking here about federal laws. So these are things that impact every state in the United States. Does that make sense? And so in looking for some materials to give you, I just did a net search, and because every state has things posted on their website. And I found some things that I thought, for each of these laws, that I thought were, pretty easy to read or understand. And so what I'm going to give you now is actually some things from other states. So this, about the Indian Child Welfare Act, is from Maine. I think you will find this article useful to you in understanding what the Indian Child Welfare Act is all about. It's written in an easy question and answer format, so I think you will find it useful. So I hope that you read this. In addition, we have an expert here in this state. He's one of our foster parent trainers, Arthur Fernandez, and I would like you to hear from him.
When it comes to the Indian Child Welfare Act, oftentimes I get questions from foster parents. And one of the questions that I get is, why, as a foster parent, do I need to know about the Indian Child Welfare Act? What is it that makes them different than other children in the child welfare system? And so what we're going to do in this section is try to answer some of those questions as why, and give you a basic understanding that you can build upon later as you get into more of the details of the Indian Child Welfare Act. In this particular section, we're going to do kind of an overview, basically. One of the things that's important to understand is that in the United States, there are over 500 tribes that are recognized federally by the United States government. In the state of Washington, there are over 300 different tribes represented here. In other words, we're surrounded in Washington state. We have 29 federally recognized tribes, that 28 of which have reservations in this state. Washington also happens to be this gathering place for tribes all over the country, as well as Alaska and Canada. And so folks were going to be coming in nationally and settling here in Washington state. And so we do. We have over 300 different tribes represented here. So the likelihood that we might come in contact as foster parents in working with Indian children is pretty high. And so I think we need to understand a little bit of that basic history as to why is it that there's a different legal structure around Indian kids. And so that's kind of what we're going to go with. As we look at this, what we're really talking about is a trust relationship. And before we get into the ins and outs of Indian child welfare and some of those specific legal structure, we want to look at how private trust law is constructed. And draw from that private trust law in order to understand how Indian children fit into the overall system. Now, in looking at trust law, what we have is trust law basically dates back prior to the creation of the United States government. Trust law dates back to the European nations. And one image that oftentimes we see in the media is that of someone coming in on a ship. They land on the coastline and they stab that flag into the land and claim it for king and country, right? Popular in the media historically. Well, with that comes with it actually a very powerful legal responsibility that does date back to the European nations. And what they were essentially saying is that we're not only claiming this land for king and country, but we are taking on the responsibility of its inhabitants. Later on, when the United States government was formed, they reinforced that concept. And they reinforced that concept through the treaties that were made with the indigenous populations here, as well as later through statutes, through the law, and later on as this understanding of this trust relationship began to grow through the courts. This trust relationship refers to a legal and moral, or in other words, a fiduciary responsibility from the United States government towards the American Indian tribal governments. Now, this is a great oversimplification. However, to put this real simply, this basically means that the United States government is morally and legally bound to act in the best interest of the indigenous people, the tribal people and the tribal governments. However, how this responsibility was carried out resulted in what some refer to as multi-generational compounded trauma. As we talk about Indian child welfare and talking early on about the United States government's fiduciary obligation, one of the things early on that was happening, as you know, were the Indian Wars. And within sight of the Indian Wars, and at the conclusion of the Indian Wars, and as the treaties were struck, one of the things that occurred was the relocation of the Indian population. Say, for example, one well-known atrocity, if you will, was known as the Trail of Tears, in which what they called the 5 civilized tribes, the Choctaw, Chickasaw, Cherokee, Seminole, and Creek, were essentially relocated from the southeast and asked to basically walk across the country over to Oklahoma, where the United States government had essentially, set up this land as part of their fiduciary responsibility. But at the same time, attempted genocide, utilized biological warfare to impact the population. And how did they do that? Well, they had them walk during the middle of winter. They gave them poisoned blankets filled with smallpox, as well as rancid food. And so in this scenario, when you have a population traveling across that country, certain aspects of the indigenous population were greatly impacted. Those such as the elders, as well as the children. And if we think about the role, for example, that the elders play in tribal societies, right? They are the keepers of the knowledge, the keepers of the history, the ways in which we are to be as human beings on this earth, the keepers of the medicines that kept the people healthy. And another role that they played was that oftentimes as the primary caretakers of the children. So as the parents and those in that age range were able to do the work, whatever that work, whether that was hunting, gathering, or farming, or whatever the work that needed to be done. So the elders had a very significant role in tribal societies. And obviously, under that type of circumstance, through the Trail of Tears, they were decimated. So the link to the past essentially was greatly impacted. In addition, the other thing that was greatly impacted was that of the children. The children were also, or in other words, the future of the tribe were greatly impacted. But obviously, indigenous people survived these attempts, this physical genocide, the attempt at genocide through the times of the Indian Wars and the early relocation of the tribes. After the Indian Wars and some of the relocation, the next level that was attempted on part of the United States government in carrying out their fiduciary relationship, right? They have this legal and moral relationship to carry out what's in the best interest of the beneficiaries. And the policy that came from the United States government was that we must, this is a quote, we must kill the savage but save the man. We must kill the savage but save the man. And so to do that, they attempted basically what I call cultural genocide. So instead of a physical genocide at this level, they're talking about a cultural genocide. And so what they would do is they would go in and bring the Indian children and remove them from their tribes and everything that they basically know and put them into boarding schools. And one of the things that's really important to understand about the boarding school era was that it was structured in utilizing basically a military model. And in fact, those were the ones who were put in charge of the boarding schools. There was the military along with clergy or the church. And so, and then I think this particular part of history is for a lot of indigenous people is very painful. The clergy and the military were basically put in charge. They instituted a military model. And those of you who are out there, some of you may have participated in the military. And if you think about what happens during those early times, as far as boot camp, for example, and when they're trying to train a person to be a soldier, Essentially what they do is they tear down the human being down to the most basic elements of that human being, and then rebuild them back up into a soldier. And that's essentially what they were doing, is that they were tearing down these children as much as they can through many different mechanisms in order then to take the savage out of them, basically, and then rebuild them into their view of what a human being should be. So, along with this, in this military model, with the clergy and the military at the top, then they would, and if we think about the clergy and the military, or the administrators being maybe the colonels, if you will, of their troops, so to speak. And then the eldest children then would be in a little bit higher rank than the other children. So we would go from, you know, the colonels down to maybe the captains, down to sergeants being the next level of children, all the way down to the youngest children or the privates. And so this ranking system was also put in place. Now, some of the mechanisms that were utilized in order to kill the savage was that of massive physical abuse, obviously mental and emotional abuse. These children were, if for example, a child were to speak their own language, they may very well have been beaten. The other thing that was also involved in this power structure was that of sexual abuse. And not sexual abuse in terms of like pedophilia or being a pedophile. Maybe that was going on, I don't know. But it was more intended, I think, to be a way to exercise power and to demonstrate power. And so these children were obviously traumatized by the whole boarding school experience. They no longer had, and if you think back to some of the earlier lecture when they're talking about those essential connections that we as all human beings must have, if we take a look at the Native American experience, all of those essential connections were decimated. They didn't have connections to their family, to their culture, to their language, to all of the things that they know, to being able to pray, to connect up with their understanding of God or a higher power or the Creator, as it may be. All of those things were taken away. And so these kids, these children, were greatly impacted, traumatized, if you will. But obviously we survived it. The indigenous people survived. And the next level, as these kids then began to be reintroduced into their tribe. Now, let's put this into another context, right? So we're taking these kids, we're putting them back into a tribal system that in and of itself has been traumatized. So you have the tribe who's traumatized, whose way of life themselves has been greatly impacted, and then you take these kids, remove them, traumatize them, and then putting back into the tribal systems that they had come from. Obviously, this led to more and more abuse. And so these kids then obviously would be abused with inside of their traumatized families. And the United States government, in their quest to serve their fiduciary obligation, to act in the best interest of their to carry out their trust responsibilities, then came in and the big adoption era came. And for many indigenous people, they view this era as an era of where our children were stolen again. And so the U.S. government had come in, and the Canadian government even had come in to remove in great numbers children from their tribes and adopted them out all over the country. There wasn't much thought. The adoption rolls were oftentimes closed and sealed, and they were basically taking the Indian children and removing them and putting them into non-native families, or oftentimes families from European descent. So this obviously had a great impact on tribal people. It had an impact on the children. Again, here another generation, they were losing their future, if you will. Now, And taking a look at this particular era, some of the terms that oftentimes gets thrown around is the big 60s scoop. A lot of this was happening in the 60s. And it became pretty big business. It became big business depending on what part of the country, or whether you're talking about Canada or the United States. And, you know, Indian kids were big business at this time. Now, this led to, as history moved on, we made it through the adoption era, and as indigenous people became more and more educated about what this trust relationship really meant, what the legal ramifications are, and discovering how the United States government has essentially breached their fiduciary responsibilities, we started to see lawsuits come about on behalf of indigenous people. And in fact, here in Washington State, one of the landmark cases happened out of the Quinault Nation. And the Quinaults were successful, in fact. And many of these lawsuits across the country were being won by the indigenous people based on the fact that the United States government had failed in their trust responsibility, in their fiduciary responsibility, if you will. One of the leaders in coming up with the Indian Child Welfare Act actually was coming out of the state of Washington. And we had some very active folks here, and they, through the political process, was able to get some laws passed at the federal level, which later then became known as the Indian Child Welfare Act. And that happened about 1978. 1978 was a very big year for indigenous people. A lot of good things happened, legal-wise. On one hand, you had the passing of the Indian Child Welfare Act. You also had the passing of the Indian Religious Freedom Act there in 1978. And this is significant, because 1978 really wasn't that long ago. Many folks don't know that it was illegal for a Native person to drum, to pray in their own language. It was illegal for this prayer, for the worship, if you will. So it's kind of like saying, gosh, you know, if we're going to go pray in our church over here, we could be arrested. And in fact, that's what the law was up until 1978, when the Indian Religious Freedom Act came about, is that it was illegal for Indian people oftentimes to pray or to do a sweat lodge or things of this nature. So 1978 was a big year. Also in 1978, one of the other things that happened is some of the lawyers inside of the Department of Interior, some of the lawyers, a man by the name of Krulitz, and he was known as Solicitor Krulitz, or the lawyer basically, and he, for the first time, I think in history, really fully articulated what this trust responsibility meant to the United States government. It was the first time. And he outlined where the United States government failed in its trust responsibility. It pulled back court documents historically, looked at treaties, and really articulated for the first time this trust responsibility. So a lot was going on in 1978, including the passing of the Indian Child Welfare Act. The Indian Child Welfare Act basically says that when it comes to Indian children, the tribes must have a say in what happens to those children. Now, to understand this a little bit further, we basically have a legal relationship with tribal governments that, from a state perspective, is a government-to-government relationship. From a federal government, it's also a government-to-government relationship, but it's a little bit different. Legally speaking, a tribe's legal status is somewhere higher than a state, but lower than a foreign nation. And by that, it's really a unique relationship that the United States has with over 500 different tribes inside of the United States. So this unique relationship, this government-to-government relationship, is unlike any other relationship in the world. It's unique. Now, being that the legal status is somewhere higher than a state but lower than a foreign nation, the federal government being the owner, if you will, of the trust lands, etc., has the ability to be able to enact things like what's called eminent domain, which means, for example, they could put a road through tribal reservation. They can do that based on the law of eminent domain. So their status from a federal perspective is it's semi-sovereign. It's not a full, complete sovereignty. At the same time, the federal government is required to consult with Indian tribes before enacting anything that's going to have an impact on tribal lands. But that's a whole another discussion that we're not going to get into in this particular section. What I want to focus in on more has to do with the state's relationship, because that's where we really carry out child welfare policies. And in the state of Washington, the tribal governments and the state government must work together in a government-to-government relationship, meaning they're basically on equal terms. They have to negotiate with each other when it comes to Indian kids. So one way to think about this is that, if we had a child in our system who was a citizen, if you will, from, say, from France, we would be required to work with France's government in order to determine what's going to happen with that child, right? Government to government. Well, the same is true when it comes from state government and working with Indian kids who come into the child welfare system, is that we must work with that tribal government and allow them the opportunity to decide what's going to happen with those children. So what I want to do is I want to spend a little bit of time talking about tribal involvement with case planning. And this is kind of how is this going to, one of the questions, how is this going to impact me as a foster parent who may be not from a particular tribe? I'm in the general population of foster parents, and I receive this child who we find out has some tribal connections. Federally speaking, in order for a child to qualify under the Federal Indian Child Welfare Act, they must be enrollable in a particular tribe. However, the state of Washington's has a much broader definition or a broader way to incorporate Indian children. And if Indian children are identified with a particular tribe, they can still qualify, if you will, even if there's no necessarily enough blood, so to speak, to qualify on the enrollments. If they culturally or through lineage are able to connect with a particular tribe, the state of Washington still treats that under the Indian Child Welfare Act. And that's one distinction that might be different than perhaps some other states. And so the tribal's involvement with case planning is they may decide, there's this Indian children, comes into care, we find out that this child has Native American ancestry. The department, the state of Washington, is required to connect up with that tribe. And so you'll see caseworkers oftentimes be asking the question, does this child have Native American ancestry? And they may ask that from the point of intake, when we very first get the call of child abuse and neglect on a particular child. They're going to investigate with the child's family, and throughout the course of the investigation and throughout the course, that question oftentimes will get asked over and over and over again. And if that tribal relationship comes up, then the department must make attempts, reasonable efforts, in order to connect that tribe with that child. Now, the tribe has the opportunity, once that child is known, has the opportunity to decide at what level do they want to be involved with this particular case. And so the one level would be the tribe would decide that, we want to have full jurisdiction over this case. And in which case, that child who may be in your home, if the tribe claims to have full jurisdiction, may be removed from your home and placed in with the tribe. And that could be a tribal foster home. It could be with hopefully it would be with a relative. That'd be the first place that they would try to place the child. If a relative's not available, then they would be looking at a tribal foster home. If a tribal foster home's not available, then they may look at a Native American foster home that's in the general public, maybe linked with the state, maybe with a private agency. Then, if all else fails, they may come back to the state and say, you know what, we're going to utilize a state foster home, right? So those are kind of give you a nutshell of what the placement preferences are. And the full jurisdiction by the tribe means that the tribal court system has the ability to decide what's going to happen with this child, right? Well, for local kids who are local, oftentimes that could be the case. They're going to claim that full jurisdiction. Sometimes it happens where, especially with tribes, they may be local tribes or maybe some tribes across the country, where it's a lot more difficult for their tribe to interact with what's going on here. Maybe it's a second or third generation. The child and the child's immediate family lived here in the state of Washington, and they've kind of grown up here. The child comes into the system. We connect with the tribe, say, over maybe in North Dakota. And they decide, you know what, we're not going to claim full jurisdiction. That child's really been in your state for, this long period of time. However, we want to be a legal party to the case. We want to have a voice into what's going to happen with this child. The child's going to go through your court system, but we're going to be a legal party. Okay? The next level that may happen may be case consultation with the tribe. So this is a level where the tribe says, you know what, we're not going to be a legal party, but we want to have some case consultation. And sometimes on the local level, we have what's called local Indian child welfare committees. And this is how this particular item sometimes will get played out. If a child comes into care, we might case staff a child with inside of the local Indian child welfare committees, which basically consist of tribal members as well as state workers, and they'll kind of consult with each other and decide, gosh, what's the best course for this case or this particular child. So case consultation with the tribe could happen at the local Indian child welfare committees, or the tribe just may want to consult and guide and help and connect, and maybe even connect with our local foster parents in the state system and continue to be connected with that particular child. The last level that the tribe may say, you know what, we're not going to be involved in this case or the case planning at all. We're just going to go ahead and we're going to pull out from having any involvement with this particular case, legally speaking. However, as a foster parent who has a Native child, if we really understand and take into context the history that these children were coming into care historically, whether we're talking about the boarding schools, the adoption era, or kids coming into foster care and still not being connected with their tribe, hopefully the more knowledge that we get about some of that history and some of the legalities, that we may be able to then help these children to connect up, at least culturally, or through their kin or their tribal members, and get involved, with those communities. I think one of the best ways that foster parents can really assist our Indian kids in care, assuming that they have that they're taking on those parental responsibilities, those responsibilities in some ways that's like an aunt or an uncle to this child, is to reach out to Native communities, to reach out to the tribal community that child may come from in a humble way, and ask, and let folks know, I really don't know what is going to be, appropriate or how to behave inside of this particular community. I don't understand necessarily the protocols that are involved. Will you help me? And by demonstrating that humbleness, oftentimes what I have seen in tribal communities is that folks really come out of the woodwork to try to help that child connect up with their cultural communities and their roots and things of that nature. And so with that said, I'm just going to go ahead and close this section and really want to encourage folks to take the 6-hour version where we really get into some of the details of this and how to work with Indian kids, We also cover some of the history in greater depth. And if you get an opportunity to really get into Indian child welfare and understand it, it can really serve you. The intent of this section in this particular class is really just to kind of lay down, again, that foundation. One, so that we can answer the question as to, as a foster parent, why do I need to know about the Indian Child Welfare Act? And two, why are Indian kids different? Why is there a different set of laws for Indian kids than there are for other kids in the child welfare system? And hopefully, through this short presentation, that we were able to answer those two questions. And so with that, good luck, and thank you.
In 1980, which was just before I came into this system, Public Law 96-272, which is the Adoption Assistance and Child Welfare Act, was passed. This was a biggie. I mean, this was the one when I first came to the system, everybody was saying, pay attention to this. This is what regulates what we do. And this was the place where there was some recognition that kids were drifting in foster care, that kids were getting removed, but nobody was doing anything, provide services to families. Nobody was monitoring how kids were doing in their placements. And, you know, it just sort of went on. So this then established some processes. It meant that the department had to make reasonable efforts. Have any of you heard that term, reasonable efforts? Some of you have heard that one. Reasonable efforts toward ameliorating whatever the situation is that brought the children in the care, providing services for families, for the kids, for the parents. And it means that there was that there needed to be some court structure so that the family progress was reviewed every 6 months. So we went back into court every 6 months, and the social workers needed to report what they were doing, the families needed to report what they were doing, we needed to tell the court how the kids were doing, and that created then some structure and some monitoring of that whole system. 3 important goals of 96-272. Foster care is intended to ensure that kids' needs for nurture and protection are met in the foster care system. That's part of the getting out there and seeing them and not letting them drift. The foster care program seeks to ensure that the parent-child attachment is strengthened and preserved to meet the child's needs for nurture and protection. So we're really recognizing that the kid has needs when they're in foster care, that we need to have regular visitation with the parents, that we need to maintain that relationship with the parents whenever possible, that we need to recognize what a child's sense of time is around that. And that the foster care program seeks to strengthen and preserve the child's ability to form attached relationships which meets the child's needs for nurture and protection. So there's that part about attachment, to recognize that we have a responsibility as the system when we place children in care to keep them happy and healthy on every level, physically, mentally, emotionally. We need to behave in a way that lets kids know that the world is a safe and secure place where they can trust, and that there will be people there to meet their needs, and that they can grow up strong and stable and able to have meaningful relationships with other people. The most recent federal law that has impacted us is the Adoption and Safe Families Act. And ASFA was a response to a concern that even with the structure that we had, that kids weren't moving through the system quickly enough to permanence. And that was the main focus, the main drive behind ASFA is getting kids to permanency as quickly as possible. Now, what do we mean when we say permanency? First and foremost, that means returning children home, right? But if children cannot return home, we need to, as quickly as possible, make the best decisions for that child and secure them permanently in the most stable and secure situation. The primary answer to that, then, is adoption. It means that at that point, we may terminate parental rights, and in fact, ASFA requires that we file for a termination of parental rights for any child who has been in foster care for 15 out of 22 months. That's on the last page of this, if you want to look at that. 15 out of 22 months. So that, for most kids, that means the 15-month point. But it also means that if kids go home and then come back out, that any accumulation of 15 months over a period of 22 months then means that we need to take some action around that. Now, in this state, we have in our laws modified that a little bit. Our practice is for kids who have been in placement for 12 out of 19 months. So we've just backed that all up by like 3 months. And I think there's a variety of reasons for that. One is that I think best practice really says 12 months is when we need to be achieving permanence for kids. The other is that if we have our laws backed up 3 months and our whole court system is geared to that, then if we don't achieve it for an extra 3, we're still in compliance with feds. It's important for us to be in compliance with the feds. Now, if we break these laws, do they come and throw us in jail? No, they probably do something worse. They take our federal funding away. And the federal funding is a huge portion of our budget. I haven't checked for a while, but I think it's somewhere like around a third of our budget. Do you know, Carolyn?
I think it is.
Yeah,
and
about a
foster
third of
care
our
and
budget.
education, our reimbursement rate is 75%.
Yeah.
So, I mean, it's a big chunk of change.
Right. The feds are very, very important to us.
I didn't understand that. When you are not applying with what, then they're taking funding away. Can you repeat that?
The federal government comes out and looks at our records on a regular.
How often you move a child?
They come. That's one of the things they look at. They look at a lot of things. But they come out and visit this state regularly, and they read a sample of cases, and they see if those cases are in compliance with the federal law. If we've done the things that we needed to do in a timely way, if we've monitored the case the way we were supposed to, if we have done the legal process in the way that we're supposed to. And if we haven't, there can very well be huge financial penalties to us for not being in compliance with the federal laws.
So how can it be that a child, for instance, I'm talking of course of personal reasons, be in 15 foster homes over the last 10 years, and there's a family who would like to adopt, and that's not going to get pushed. So
Gee,
what kind of
have I ever
penalty
been
can be
asked
put on
this
that?
question before?
Yes, I'm sure.
Right. And, you know, I don't really have a good answer for that. What I can tell you is that all of you know that there are kids who have been in foster care for more than 12 months, right? And we haven't moved on permanency.
What does moving on permanency mean?
It means that the kid is where they're going to be while they grow up.
Okay, not the final act, but the actual moving toward that?
No, the final act.
Oh, okay.
Yeah.
Well,
What
that's
this
not happening
says,
either.
what this says though is termination of parental rights. It doesn't say finalizing adoption. The standard is that we should be finalizing adoptions for kids whose permanent plan is adoption within 24 months of placement. Yeah, yeah. I mean, and there are a lot of reasons for that. Some of them are good reasons and some of them are not so good reason. I mean, our system moves slowly. It's understaffed. I mean, and I'm not just talking about in the Children's Administration. We can't move on the legal stuff if we don't have AAGs to represent us and who can do all of those things. So there's many, many factors. The other thing is that ultimately these decisions about whether or not kids return home, whether or not parental rights are terminated, those are not decisions that we as social workers make, are they? And that's part of these federal laws and creating a court structure around it. These are decisions that are made by the courts, by the judges.
Yeah, but the social worker can help pushing that through better. It depends on what the social worker's role is and how the social worker represents the case.
Yes.
I mean, there are social workers who really, they work day and night, and then there are social workers who you call 100 million times and you never get an answer.
Right.
You know?
You're very right.
I mean, definitely the social worker is a part of that. You can't just push it away and, you know, point fingers at somebody else.
Yes, you're absolutely right. And another thing that's a pretty common thing is that, you know, we will go to court and families will be doing marginally well. And you think if they could just have another 3 months, if they could just have another 6 months, maybe they will get it together and the kids can go home. And that's always better when kids can go home, if their parents are able to provide for their needs. So that's the best answer that I can give you. I'm sure all of you are thinking in your minds of situations where you don't think that fits, right?
Well, especially if the child's parental rights, the parental rights are gone and the child is open for adoption for 3 years, and then there is a family who want to adopt, and for whatever reason, it's still not working. That's hard to understand, to leave a child in a group home or pushing the child from place to place after 3 years of no parents are there.
And I certainly wish that we lived in a world or worked in a system where that never happened. But it does. It does, and it probably always will. We just need to remember what best practices, first of all. And we need to remember what's in the best interest of children and remember what's in the best interest of families. And to always act on that.
Well, that's the problem, the best interest of a child.
Yeah.
This word, I can't hear it anymore.
Yeah.
If it's the best interest of the child, then we should get together and think about the Brown Law, for instance, what that brought out, and really, I think, work better together as a group. I think that's one other problem I see. A group effort.
Right. Do all of you know what the Brown lawsuit is? A couple of years ago, I guess more than that now, there was a class action lawsuit. Actually, it started right here in beautiful downtown Bellingham on behalf of, I think there were 13 foster children that were in that initial group who had multiple placements. Mostly they were teenagers, you know, that were really hard kids. And they moved around a lot, and they didn't always get the mental health services that they needed while they were in care. And their foster parents were not always prepared to meet their rather complex needs. The result was this lawsuit, which then resulted in a settlement with DSHS, in which we agreed to many things that are now part of our plan to improve the system. But it includes things such as making sure that foster parents have better training, making sure that kids get engaged in services as quickly as possible, providing support to foster parents, preventing, I mean, all of those are things that then prevent kids from being moved around so much. So that's an important factor right now in how we do our work, the Brahm lawsuit settlement. So we have the federal laws. We have this Brahm thing that regulates what we do. We have, in response to our federal review, we have, it's called the Program Improvement Plan. We call it the PIP. And we have Brahm. And then there are state laws that influence what we do. I won't talk too much about those because those are pretty specific to programs, but there are things that we do because people in our state decided that these things are helpful to us in how we operate. The creation of child protective teams. Do you all know what child protective teams are? They're when there are groups of professionals that review cases, basically, and give the department advice on how we should go forward with the case. Programs such as family preservation services, therapeutic child care, a continuum of care projects, which are something else. All of those things came about as a result of state laws. The other thing that influences our practice, I think, is that whenever we have a child who dies who is in, who has been known to our system, we do a fatality review, and we look at if there were things in our practice that we could have done differently that might have prevented that child's death. So there's a lot of constant review about our practice and about how we do things, a response to a lot of folks, the Brahm folks, the legislature. We have a lot of bosses. Sometimes we feel like the media, the newspapers and the TV news are our bosses because certainly, you know, they scrutinize regularly what we do. I do think that social workers as a whole are very caring and responsible individuals, but, you know, they have hard jobs. They have very hard jobs. And sometimes I know that it may not look that way to some of you. This article, Voices from the Inside, talks a little bit about what the child welfare system looks like in the United States. In the United States, there are about 500,000 children who are in foster care. That's a lot of kids, isn't it? About 500,000. Here in this state, depends on how you count it, we usually have about 6,000 or 7,000 kids who are in licensed foster care, maybe another couple thousand who are in relative placements, and about 1,000 that are in higher levels of care, therapeutic foster care or group homes. So on any given day, there's probably around 9,000 or so kids that are in out-of-home placement under our jurisdiction in this state. So one of the things that I like about this article is it talks about the cost of foster care. Now, we all know that if you're just talking about the cost in terms of dollars, that's a pretty good figure, right? But this is talking about the other kinds of costs, the intangible kinds of costs to the child welfare system. And that's the cost of insecurity, the cost of poor communication, the cost of inflexibility, the cost of not securing timely help, the cost of professional burnout, and the cost of stigma. So let's talk a little bit about each of these things. What do we mean when we talk about the cost of insecurity? It means that kids who are in foster care don't feel that same sense of safety, security. that kids in their own biological families do. It can be difficult for children who are in foster care to maintain the important relationships that kids need to have. If they're separated from their families, if they're not living with their families, changing schools, not being able to be in their Cub Scout group, all of those things that are disconnects for kids when they are placed in care. I always say that making the decision to place a child is making a decision to do some damage to that child. It's a very, very hard thing to do. So the decision that social workers are always having to make is it more harmful to remove that child or to leave them in the home, right? That makes sense. And you guys have all seen that, right? The social connections in their communities is a hard thing for kids who are in foster care. So there just isn't that same sense of security. The cost of poor communication. It's difficult for kids to understand what's going on with them. There's lots of times when they don't get the information that they need to understand what's going on in their lives. Even if they get it, it may be beyond what they're able to comprehend, right? They may have to change service providers several times, change daycares or mental health providers or whatever other services that they're involved in. That creates an upheaval in their lives. Going back to information, the information for parents and for foster parents and for adoptive parents. All of you can probably think of a time when there was something you needed to know that you just couldn't get the information for, right? That's never happened, right? Nah. Yeah. So that's one of the costs, the poor communication. The cost of inflexibility. One size does not fit all is what this is about. The system may not be able to respond quickly, or may not be able to respond at all to unique needs of children, of families, because of the various rules and regulations that we have to follow. I see that frustration on the part of social workers sometimes when they see, can't I just get this kid in this program? I think that this is a program that would help them, but the child doesn't fit the profile of the child that needs to go in to that program. You know, like FRS, you have to be 13. Well, what do you do with a 12-year-old who's in conflict with their families, you know? But our programs need to have that structure around them, and there's many reasons for that structure. Some of the time, the reasons are funding. We can only afford for the 13-year-olds to be in that, or a variety of things. So the inflexibility can be a hard thing. The bottom paragraph on page 3 talks about the value when everybody sits down together, when the professionals involved with the family, the service providers, the family, the child, the extended family can sit down together and creatively create service plans for kids. That really is a best practice thing. And I'm pleased that we as a state are getting better at that now. We have family to family. Are all of you familiar with that phrase? We have a variety of programs that really mandate or create a structure for bringing kids and their families and all of the folks in their lives together. Family group conferencing is one of those things. Family program is one of those things. There's a variety of models that do that, and that's becoming a pretty high priority for our system right now to do that. What I think we really learned from programs like family group conferencing is that if we can just get the family including the extended family, together at the table, that they really are better problem solvers than we are. And when people are involved in their own solution, aren't they more invested in making that solution work? Yeah, nobody likes it when we come in and say, this is what you will do, right? People, even when they are trying not to be, tend to be resistant to that. The cost of not securing timely help. This is really about the importance of prevention. If we could provide the kind of services that families need before they come to our attention, wouldn't that really be a better way to go? Now, we are not a prevention agency. We are an intervention agency. We, by mandate, by purpose, by mission, are there to come in after the fact. That will always be the case. But there are agencies where prevention is their priority, and those organizations, those services need to be valued so that kids don't have to come this far. Yes?
I don't know if it's still, but at some point it used to be that in order for a child to get services that they needed to get into the system.
That, I think, is still true.
And that's still true.
Uh-huh. That's
So
definitely true.
So there's sometimes things that they really need they cannot access until they get into. So that's not helping the parents.
No.
Okay.
No.
So it hasn't changed.
Yeah. Well, I mean, I guess I would like to think that that's perhaps gotten better. But it certainly is still true. Kids who are in our system have access to services that a lot of other kids and families don't. An example of that would be kids who are in foster care have Medicaid. Medicaid as an insurance, as medical insurance, is the key to get into the door for mental health, for substance abuse, for physical health, for all of those things. And it may be that their families aren't eligible for Medicaid. You know, that's a biggie. It's a biggie. The cost of professional burnout. This applies to all the various folks who work in the system, from the social workers to the judges. It's about having unmanageable caseloads. It's about having adequate training. It's about having all of the information at your disposal that you need to have at your disposal. And it means being able to bridge all of those barriers that come when you're out working with families. Language, cultural, socioeconomic, everything. And that, foster parents, I think I didn't say that, but certainly that's true as well. Anybody here experiencing any burnout from time to time? Yeah.
I took a year off.
Yeah, I thought so. So, being able to cope with those things involves a cost, right? There's a price to be paid when people have too little information, too large of caseloads, et cetera, et cetera. The cost of stigma. This is the stigma that's associated with, for kids, being in foster care, for parents having your child in foster care or in the child welfare system, or for foster parents being the one that provides the care for these children. Has anybody ever had anyone say to you, oh, you're just in this for the money? Yeah. Does anybody believe that could ever be the case? No, they just don't know. So there is, people sometimes feel that stigma of being involved with our system. And that means that ultimately the cost isn't just for those folks, but for our society as a whole, right? Because all of these intangible costs take their toll. This is the essential connections. And I share this with you now because we just talked about some of these things and the costs involved with them. The purpose of this model is that all of these things, there's 7 connections on this page. All of these things are necessary, essential connections for a person, for a child, to have in order to be functioning fully as a human being, to be happy, healthy, stable, etc. And that's access to information. We just talked about information and the importance of that. To a significant person, to a group, to a meaningful role, to a means of support, to a source of joy, and to a system of values and morals. Now think about these 7 things. And think about what things a child who is placed in foster care is disconnected from upon removal. How many?
Could be all of them.
Could be all of them, right. And the theory is that, you know, we all is out there, human beings trying to get through the day, occasionally are disconnected from 1 or 2 of these things, right? Sometimes we don't have the information that we need. You know, sometimes we don't feel like there's any meaning to our role. You know, all of those things, but, you know, we sort of sigh and we go on, you know, and we get over it and that passes and another thing comes, right? And as long as we're only disconnected from 1 or 2 of these things, we have good coping mechanisms and we're able to get by, right? But the more of these that a person, any person, is disconnected from, the more likely it is that you will see some dysfunction exhibiting itself in their thinking, in depression, in their behavior, in whatever way. They simply become less functional. So when you think about all of these things as potentially being issues for kids who are in care, and occasionally for you as foster parents, right? You can see that it's very important that we get reconnected to these things just as quickly as possible, right? So, you know, getting visits going with the family, making sure that whatever information you have, you are sharing, you know, with everyone. That social workers are sharing information with you, that you are sharing information back, that everyone is sharing information with the child and with the family, right? Now, there were 2 more connections that the foster parent scope materials added to this here in this state that we thought were specific or unique to foster care as opposed to a more generic kind of a situation. And that was a sense of personal history and a connection to their culture. And you can see why those would be logical things to include in here when we're talking about foster care as well. Okay, so keep this in mind later when we talk about attachment and some of those things. But this just seems like a good place to talk about it when we're talking about all of those intangible costs of foster care. This was a literature review about multiple placements in foster care. A literature review is when some research organization, usually a university, goes through and reads all of the studies and sort of brings all of that information together and looks for the trends and figures out what everybody is saying on a certain topic. So this is what everybody is saying about the impact of multiple placements on foster care. So, definition first of multiple placements. Generally, that means 3 or more placements. during the child's whole expansive experience in foster care. That was the definition that was used in the Brum lawsuit that we talked about earlier. So how many placements do you think is the average that kids in Washington State have had? Remember, Carolyn's here with the mic. How many do you think? Anybody want to take a guess?
7, 8.
7 or 8?
That would be my guess.
7 or 8? 7 or 8? Any other guesses?
5.
5? You want to know the answer? None of you are going to believe this. 2. 2. Yeah, see, you look incredulous. Not the kids in my home. Right?
When was that study done?
That actually is not a study. That's our data. And that's updated every year. And consistently over time, that's what it's been for like as long as I can remember. Don't you think so? Yeah. So how can that be when you have kids in your house that have had 7 or 8, right?
Well, I had one child had 8 placements in 2 months.
8 placements in 2 months. Was that child a teenager?
No, she was 3.
Oh my God!
I was told she was the kid from hell, and not to take her, but I took her, and it was successful, and she's actually been adopted by her grandparents and is doing well.
Oh, well, that's a happy ending story. That's a good story.
But she was a very difficult child for about a year.
Well, that's, yeah, good for you. Good for you. Go ahead.
I have a set of twins that we are the 4th foster parents, and we're going to adopt them. So, and they were, I mean, that's 4. I mean, placements in less than 2 years.
And they're how old?
3.
Jeez, these little kids. You've
I
got
also
some
have
hard
a
little
teenager.
ones.
I have a teenager that is wanting, in fact, she volunteered herself to stay in the system, and she just turned 18, and she's been in the system no less than 6 times.
Well, I think what you can see is that there's this percentage of kids that have multiple placement that sort of skew the statistic from others that only have 1, right?
I have 2, a 2-year-old and a 3-year-old, that have been at my home for over 26 months. So that really kind of skews the system in the other
Right.
direction then, too, if you're talking about your mandated time periods.
Right, yeah. Yeah.
But they only
Yeah.
3.
So,
Wait.
yeah, right, I know. I'm planning college.
So how can it be so different? Well, I think there's a couple of reasons for what you see against what the statistics show. The first is that I think it's something like 40% of kids return home within 60 days. And by 90 days, I think it's 60% of kids return home. Well, kids that are in care, and many go home like within 5 days. They're removed because there's some crisis going on and the kids can't be there, but then immediately, the family gets it together and they're back home, by the next Monday. I mean, that happens a lot. But then if you just take that 60% of kids who are back home within the first 90 days, and they have likely only had 1 placement, then it's that other 40% that we're looking at. And there are many things then that cause them to have more placements. And you guys have hit on some of those things. So 2 is not an unusual number. I mean, kids often will come into receiving care immediately, and then within a day or 2 will move then onto the longer term home where they're going to be for the rest of their time in care. That's okay. I mean, that's kind of how the system operates, right? And kids, if they're only there on a temporary basis, it's more like babysitting than it is like placement, right? And they haven't gotten attached, and this isn't a disruption and all of that. So generally, 2 placements is seen as acceptable in our system. More than 2, there's something going on, right? And here's the part of what's going on that I don't like to hear. There was a study in 1999 that showed that almost half of all replacements of kids that were moved, were policy related. Oh, she's, oh yeah, I knew that. See, now that's shocking to me. Oops, I better not touch my mic. That's shocking to me that almost half are related to policy. So there are things that we can't control, right? I mean, there are reasons that kids move that are beyond our ability to control. But when you think that half of them, I think things that are policy related are things that by definition should be within our control, right? So that means that's where we need to put our energy. That's where our efforts need to be in reducing multiple moves. I don't like the idea that half of cases are because of something in our rules that have either made that necessary or made that possible, I guess. Yes?
I think one other reason is improper placement of children in an inappropriate home, the one that's not geared for that child's problems. And then they go into that home for a week or 2, and the foster family says, oh, wait a minute, I didn't realize this was going to happen. Throw up their hands and say, I can't keep this child.
That's right. You're exactly right about that. About a year or so ago, wearing my DSHS hat, I led a work group to look at these issues about matching foster homes with kids. And people that were on the work group were folks like the placement coordinators in the various regions and other folks that really felt invested in having the best outcomes for kids. And, you know, it wasn't too hard for us to come up with all of these ideas about how we could match kids and foster homes. But when it all came down to it and our work was done and we had our list and we'd identified a possible process, what do you think the placement coordinators said to me?
The homes aren't available.
The homes aren't available. Yeah, and the bottom line was, this is all well and good, and we could put this in place as policy, but the bottom line is, the best match of homes is the one that has the empty bed. And until we have more foster homes where we have a choice of 3 or 4 and can say, here's what this kid's needs are, and here are the choices of families, and which is the best one to meet those needs, then none of that really matters. But these are not times when we have a lot of choice around
And
that.
the policy dilutes that choice also.
And the policy, say more about that.
The policy says that you may not do certain things. Well, maybe this child is in a perfectly wonderful, wonderful placement that's going to be wonderful for the child, and all of a sudden the policy says, oh, wait a minute, you have 1 child over. I can't give you a waiver. So we've got to pull that child out of your house, and she's going to go into the 7th foster home in 6 months because you're over your limit.
Okay.
Even though you're capable of taking care of this child.
Yeah.
So that's where policy kind of makes those things.
It's true.
It
It's true.
exacerbates the problem.
That if we had more foster homes, we wouldn't have to have 7 kids in your home.
Right.
When we came to you and said you are the best match, you'd only have 3 and it wouldn't be a problem. Right? Mm-hmm. Yeah. Yeah. Now, there are some legitimate reasons for even policy-related changes. If we're using receiving homes, for example, and can move the child within a couple of days, well, you know, that is a move. That's policy-related. But, you know, it's probably not a bad one. If we're moving to put all the siblings together when we've had to place them apart, maybe that's a good one. I mean, there are a variety of reasons. But I think the thing about this statement that's important to me is these are the things that we can control. And we need to create our system in a way that minimizes multiple placements. based on the things that we can control, knowing that there will always be things that we can't control. There was a study on placement instability in San Diego County that found that 7 out of 10 placement changes occurred for system or policy related reasons. So again, one study said half, one study said 70%. So what does that mean? Here's why you came today, right? What does that mean then when we move kids around? It means that, surprise, there's a link between multiple placements and behavioral and mental health problems. Is anybody surprised about that? No. Educational difficulties? Anyone surprised about that? No, I didn't think so. And juvenile delinquency. Anybody seen that happen? So those are some pretty good reasons for us to prevent multiple placements. So does that mean, this then is sort of a chicken and the egg thing? Do those problems come about because of multiple placements, or do multiple placements come about because the kids have those problems? Both. Yeah, you're right. It's not difficult to see that. Kids come into our system, they have those issues. So that goes back to the things we just said a little bit earlier about how do you then enable foster parents, support foster parents to deal with those issues so they don't result in multiple placements, right?
I mean, I've called for help times, and there is no help.
Yeah, sometimes that's an unfortunate truth.
I don't know, maybe it's getting better, but I would hope so.
And I guess that I would hope so too. I guess that what I hear from where I sit in DSHS, a lot of concern about that and a real strong desire to make that better. Whether it's being felt from where you sit, I don't know. I hope so.
I haven't needed it recently, so
Yeah.
I don't know.
Okay. So, it happens both ways. But whether or not kids come in with those problems, what happens if they then bounce out of placements because we don't have foster parents who can cope? Do the problems get better or do they get worse? Oh, yeah. They get worse. Right. So that's the important piece of that. Child development theory posits that repeated movements jeopardize the opportunity of children to develop secure attachments with caregivers and trusting relationships with adults. That's Bowlby. Bowlby is sort of a guru around some attachment theory. Anybody surprised about that statement? No, I don't think so. Stable and familiar placement facilitated bonds of attachment of children, even to mothers who were not currently the custodial caregivers. Now, I think that's an interesting one. We'll talk more about attachment later. But this is saying that when we make the decision to place kids, if we do all of these things to provide the best possible care to children and make it a nurturing and safe environment and all of that, that improves not just the child's behavior, but that child's ability to maintain the attachment with their primary caregivers, their biological parents. So I like that piece. I think that's an interesting one. I mean, that doesn't mean that happens exclusive of the parents, because we still need to do the visitation in a timely way and do all of that work at really maintaining that connection. But it means that just the fact that kids are experiencing safety and stability and care means that they are improving their ability to go back to their biological families and experience safety and stability. So that's a pretty important thing that we provide there, isn't it? Children who did not initially exhibit behavior problems, number of placements were associated with later behavior problems. Anyone surprised by that statement? That's kind of what we just talked about. Kids with behavior problems are more likely to have multiple placements, are more likely to have greater behavior problems. Infants who experience multiple placements experience problems with attachment and bonding. Anybody surprised by that statement? No, no. Babies especially, when we talk about attachment, we'll talk about more of this. That's the time when babies learn, when they gain the capacity to attach. So, multiple placements before age 14 were associated with higher rates of delinquency. That, I think, is also not a surprise. And somewhere in here it says something about babies who experience stability. Oh, yeah. Children who had 2 or more moves during their first year of care were more likely to experience placement instability in long-term foster care than kids who had 2 or fewer placements during their first year. So that first year kind of sets the stage for the later stability. I think that is a really interesting fact. It's kind of like if you can get the kid in there and keep them stable and let them experience that stability, keep them grounded for that first year, then they're more likely to stay there than if they just come in and there's a lot of disruption in the beginning. That sort of enhances the possibility of the placement instability continuing over time. Instability risk factors. What are the things that contribute to a placement being unstable? Problem behaviors. Anybody believe that? Yeah, not a problem there. You know that that's true. And then we can talk about what we've already talked about, foster parents' ability to deal with those, you having the toolbox, you having the skills, you having the support, you having the resources to deal with a child's behavior. Prior instability, that's what we just said. You know, kids had multiple placements. When they come to you, they're more likely to blow out and have multiple placements in the future. Age at placement. Older children are more likely to experience multiple placements than younger children. That's probably not a surprise to anyone. I mean, the kids with the most placements are the teenagers, right? Because they can be pretty difficult by the time they get to us. Now, there are 2 things going on here. One is, the older they are, the greater the length of stay that they've had in foster care, potentially, right? And the older they are, or the longer the period of time that they've lived in the dysfunction of their birth family, the more likely they are to have difficulties when they're there. So both of those things would lead to it being true that the older the child, the more placements. I think somewhere in here, the effects of age drop out when the behavior problems are taken into effect, because older child, more placements, but when you look at the behavior problems, then the age doesn't matter. So that's you can see the connection then in that. Other predictors, kids who are removed for reasons other than neglect have been shown to increase the likelihood for placement instability. Children from homes with a history of substance abuse are more likely to create instability. Children were found to experience fewer placements when their parents prepared them for the placement, and even when they accompanied them on pre-placement visits and to the placement itself. Now that, I think, is an interesting one, and it makes perfect sense. But the way our system works, it's not common for parents when we're removing their children to say, here, let me come with you and make this better. You know, there's a crisis going on. There's, you know, a lot of stuff going on right then that's very stressful. I think, though, that you can take this one step further and say the sooner that the parents get on board and are supportive of that relationship with the foster family, the better I think it will be. I think one of the really hard things for kids is to feel that those torn loyalties. You know, here they are in this foster home with these nice foster people, you know, and they like it there and it's fun there and it feels safe there. But they love their biological families and they want to be with their biological families. And, you know, if I allow myself to feel good about being here, am I somehow betraying my birth family? For kids to be able to see a positive interaction between their birth family and their foster family, I think that is so powerful. I mean, this is a personal bias of mine that I've always felt from when I was doing social work, is that I saw as one of my jobs was to facilitate that relationship between the foster family and the birth family. And that meant a variety of things. I think a lot of foster parents just say, I don't do birth families. And I think there's some reasons for that. Foster parents, when I've said that in groups of social workers, they say, well, foster parents said that they don't want to do that. Well, where did they get that opinion? I think that we as the social workers, as the system, contributed to that. Because I think that we may have said, you know, here's this child, but you, Mrs. Foster Parent, don't have any contact with this parent right now. You know, we don't know enough about them. Things are really in an uproar right now. I don't want them to know where you live. I don't want you to give them your phone number. I'm going to be the intermediary right now in any connection that you have with them. That may be legitimate at day 2 of a case, right? It may not be legitimate at day 32 in a case, because by then we have enough information. And I think that social workers often don't come back and say, now remember, this is the world according to Dinah, don't come back and say, we've done our investigation, you know, we know more about these families now, I think we need to get you guys together, I think we need to find a way for you to communicate. We know they aren't axe murderers, you know, but I think that social workers don't always come back and say that to the foster parents. So the foster parents are often left with the axe murderer image, and you know, we don't have too many axe murderers.
I guess I've seen also the opposite of that, where there's been contact at the beginning and then the bio family harasses. I've been harassed, and they make allegations and they make all kinds of comments, and at that point then we stop that relationship, and I end up bringing the child early through the back door and leaving the other way. And so it works both ways.
Yeah, it does. And I think that we as the system, as the social workers, have some power in that situation. Yes. By setting the appropriate structure up front and then changing it as the situation warrants. I know that there was some planning a couple of years ago around, and this didn't end up going anywhere at the time. Whether it will go someplace, I'm not sure. Where there was going to be a requirement, but I say requirement, but I don't really mean requirement, because foster parents certainly had the ability to say no. But the practice I'll put it that way. The practice was going to be that within 72 hours, there would be a phone contact between foster parent and birth parent, and the social worker would be the intermediary on that call. And it was more like an introduction kind of thing, you know. It's like, parent, here's foster parent, chance for the parent to tell those foster parents all of the things about their child that they, as the parent, are the only ones that know, you know. How do they go to sleep at night? You know, what's their favorite food? You know, all those things that you would often like to know as a foster parent, right? But may never find that stuff out. So it was a chance for the parent to say all of that to the foster parent. And for the foster parent then to be able to reassure that parent that their child was being well taken care of, that you cared about their child, and that you had their child's best interest at heart. I actually thought that was a really good idea. Foster parents could say, no, I don't choose to do that. But for most cases, maybe not all, but for most cases, I think that that would be a really useful thing. I mean, it was done in a real neutral kind of a situation, but it was just contact.
Why isn't that happening?
I think because there were too many changes happening at once. So all of the change kind of slowed down a bit because it was becoming unmanageable. And a lot of that was, well, it was a result of having our federal review and us getting, you know, a list of all of the things that they want us to do differently, and our leadership got overambitious in all of the things that we should do, and you know, the troops were falling on the field, you know. So we all have slowed all of that down, and it's going to take longer. So I mean, I think what we know is that that's on somebody's radar somewhere, and at some point may happen. Now, there is nothing, if you think that's a good idea and something that you would like to do, there's nothing to prevent you from doing that now, from saying to the social worker, can you help me make phone contact, you know, within the next day or so with his family? I think that will be useful.
But then there's also the Privacy Act that makes it sometimes difficult. Where, you know, you have to have consent forms and may not get the consent form to even just, you know, call somebody and talk to people.
Sure.
I mean, that was,
Yeah.
for me personally, very difficult when my child was placed in a group home. For 3 months, there was no contact because of the privacy laws, and
Right.
I was just the last foster parent.
That's
I had
right.
no legal
But
rights.
you were not a party to the case.
Even I took care of it for 2 years. I was the last foster parent.
Oh,
so
that's really hard, isn't it?
yeah.
The longer they wait for a permanent home, the more likely there's going to be multiple placements. So that's all the bad news, right? Those are the risk factors. Well, now let's talk about what some of the protective factors are for stability. So I think this is the positive piece. This is the stuff that we need to think about when we're thinking about how we can do this better. So what should we be doing in order to make this the best situation for kids? Research suggests that placement stability might depend as much on foster parent and worker characteristics as on the behavioral characteristics of the kids. Okay, again, what can we control? What can we not control, right? You know, we can't control what behaviors these kids come in with. But hopefully we can impact how the social workers behave and how the foster parents behave, right? So let's focus on that, because this tells us that part's important. So one factor for stability, kinship placements. We know that kids who are placed with relatives don't move around as much as kids in stranger foster homes. That's probably not a surprise. That's an important piece. Okay, family foster care. What are the factors for stability there? specialization in the foster homes. That has to do with the matching piece again, right? We've got this kid with this needs. Which foster parent is going to be the best one to provide that? And it doesn't mean that every foster parent needs to be able to do everything, right? We need to have folks whose interest and knowledge and experiences in this. Teenagers, kids with handicaps, whatever that might be, right? Having those homes specialized is one protective factor for stability. Getting kids into services as quickly as possible. That way, you're not being required to be the provider of the therapy when that's not your job, right? Foster parent empathy and tolerance. That's a big one. That's a characteristic that we should be screening for when we go out and license your home, right? Does everybody here have empathy and tolerance? Mm-hmm. If you didn't have it when you came in, you've learned about it, or these guys are saying, oh my God, is it here? We better find it quick because we're going to have a first placement. And better matching of kids who exhibit the difficult behaviors with foster parents who are able to cope with that. Yes?
There are a lot of instances where brand new foster parents get placements of the most unruly children, and after a weekend or something, they will come in and say, here's my license, I'm turning it in, I can't do this.
That's right, because the experienced foster parents have learned when to say no, and the inexperienced ones say, oh, here's our first kid, how exciting. Learn to say no, even when we beg. Let's see. A study of a professional foster care program in Cook County reported higher levels of stability when compared to both specialized and regular foster homes. A study of foster parent characteristics, this is an interesting one, found that authoritative foster parents who set limits while being accepting of behavior infractions are less likely to become upset when children misbehave and are less punitive than authoritarian foster parents. So authoritative versus authoritarian. What does that difference mean to you? Nobody wants to venture a guess? Okay.
Well, you have to have a certain kind of flexibility. I mean, you can't just go and say, okay, I expect this and this and this from you. You have to kind of look at the child's need and then kind of set some rules around that instead of saying, okay, you have to go to bed and these are the rules. Just kind of be flexible and give it some time and,
Yeah, I think that's a really good explanation of that. Someone who is authoritative isn't afraid to say, in our house, this is the way we do things. But that's different than the authoritarian, which is rigid and inflexible, where the rules are the rules, there's no adjusting for the uniqueness in each child. We meet them where they are. I think that's a good way to put it. Foster parents who are more accepting and do not place the responsibility to adapt exclusively on the child exhibit greater stability. That, I think, is an important one. And that has to do with that meeting halfway. We all have to adapt, right? The kid can't be the only one adapting. You have to be able to adapt as well to that child's needs, to that child's wants, to the unique things about that child. You need to be the parent that that child needs, which may not be the one that's the rigid standing here. Probably isn't, right?
But I want to say something about that too. I mean, you see it everywhere, commercials, and just take the child in, needs a loving, caring home. what I found, especially with the reactive attachment disorder child, they don't sometimes, or most of the time, you can't just take them in and love them. That's the last thing, that love and caring and hugging, what naturally comes. You have to forget all your natural instincts sometimes when a child comes in, especially with reactive attachment disorder, and have some rules and then let the child slowly adopt. But a lot of times you get these kids and say, oh, if it's just being loved and cared, and that can be the wrong thing. If you give them
That's
too much
exactly
of that
right.
love because they're so afraid, oh gosh, you know, I'm going to attach and then this person is going to leave me again.
Mm-hmm. I think you make a very good point. Kids with reactive attachment disorder often need parenting strategies that are contrary to what our instincts tell us to do. I mean, and that can get into a whole clinical discussion that I'm not qualified to have, and you know that you don't need to have. You just need to understand. But it has to do with the RAD kids have high need for control. They're very manipulative, and that feeds into a whole bunch of stuff. There's one whole treatment strategy that has to do with taking all control out of a child's hands, you know, and they have to then like earn little bits. I mean, they can't even go to the restroom without asking in this really, you know, very structured clinical kind of setting. It's just interesting to think about that. But often the things that, I mean, I tend to think, you know, I want to give kids choices. You know, that's what I learned about parenting, you know. It's, do you want to wear the blue shirt or the red shirt, you know? Do you want to do your homework right after school or after dinner, and we'll structure the day that way, but, you know, you have to do one or the other. That doesn't work very well in many cases with attachment disordered kids because they tend to be manipulative and they tend to have high needs for control. So I think that's an interesting point to bring up. Another protective factor for stability related to foster parents. Foster families have good, solid support systems. That's not a surprise to anyone yet either, right? You know, having a support system may be the thing that keeps you going, is having someone you can call when you just think you can't make it another moment. Okay, let's talk about caseworker characteristics, social worker characteristics that are predictive of stability. You know, I wonder if social workers know how much power they have in a child's stability. I bet they think it's all your fault, don't you think? I'm kidding you. Okay. This first statement is certainly one, you know, I told you a little bit about, you know, the federal reviews that we have, and this last one, which was a little different than what we've ever done before. It was called Children and Family Services Review. The first time they've ever done it with the states. They did it with all 50 states. Instead of focusing on do these states meet a minimum level of compliance, they focused on what's best practice and how close does the state come to doing best practice. And guess what? Not a single state in the nation passed it the first time through. That's why we have a PIP, a Program Improvement Plan. So this study and what was demonstrated by the feds through doing these Children and Family Services reviews is that the more time and attention that a social worker has to invest in a case with the parents, with the child, with the foster family, the more likely, I mean, the results of that are widespread. Kids have a shorter length of stay, they have fewer placements, they do better in school, et cetera, et cetera, et cetera. Just having that social worker, having more contact with everybody results in many, many, many positive results. So this statement about the more time and attention a social worker has, and the better the rapport with the family, and the stability of the social worker in his or her job, are all things then that contribute to social worker characteristics that are predictive of stability. So on every level, there are things that need to happen, right? Things that need to happen for social workers, things that need to happen for foster families, things that need to happen for kids, things that need to happen for the birth families. So the conclusion of this is that a structured system of needs assessment would help, right? And that's one of the things that our system in this state is working on, is coming up with a standard way of assessing families and looking at them across many domains so that we have a real sense of where the needs are for the family and for the child. Individualized plans for kids. Every child's looked at as an individual, and the way we plan services and placement for them is based on their unique needs. Recruitment of empathic caregivers. Specialized and trained homes. Services and evaluation of kids' needs. And appropriate interventions for children and foster caregivers are all the things that can minimize placement moves. So I like this article a lot. I mean, I think it's comprehensive. I really think that this is the meat here. They've looked at all the literature and all of the studies, and this is what they found out. Now, not a lot of this is a surprise. Nobody's surprised. You may not have thought about it before, but is there anything that I've said from this article that you can't say, oh yeah, that makes sense. I think that's probably true, right? So you already knew all of this, right? So now we just all need to work together to implement it and to control those things that we have some control over, knowing that there will always be things that we don't have control over. This one is from the Institute for Attachment and Child Development, and is a study that they did related to multiple placements and criminal behavior. I won't spend a lot of time talking about this because I think we pretty much have talked about this. Basically, this says that there is indeed a connection, but they say that it's not foster care itself that causes the delinquent behavior, but that there was delinquent behavior that contributed to the placement into foster care originally. But that what happens once they're in foster care may impact then whether or not or how much the delinquent behavior continues. The longer the child spent in the first foster care placement, the lower of incidence of later criminal behavior. We talked about that, didn't we? That's similar to what was covered in the other article. Children who already had behavior problems were much more likely to have multiple moves. The study showed that delinquent behavior leads to multiple placements in foster care, and that these children are likely to continue the criminal behavior as they grow up. 65% of children who had 3 or more placements had histories of delinquent behavior prior to being in foster care. That speaks to the difficulty of the kids that come with you, or come to you, right? So I think that one of the points of this article is knowing that kids, particularly the older ones, and I think this really focuses, because we're talking about the criminal behavior, we're talking about adolescents, because we don't have criminal behavior in little kids. They're not culpable. That we need to do early and accurate diagnosis, evaluation, intervention, that we need to get kids the services they need. as quickly as possible, that we need to have foster parents who have the skills to deal with that kid's individual needs. We need to do a good match of the homes. So we already covered most of that, didn't we? How many of you are familiar with Vera Fahlberg? Any of you have heard that name? Vera Fahlberg is a pediatrician, was a pediatrician. She spent a good part of her career in Colorado working with older adopted children and helping them to attach in their adoptive families. When she retired from that job, she actually moved up here, and she lived out in ICWA for quite a while. And during that period of time, she contracted with us, and she did a lot of consultation and training for us. I think we were really, really lucky to have that resource available to us because she really understands this stuff, and she was very valuable to us. She's now completely retired and is no longer doing any of it. But the stuff that we talk about today is going to be primarily from her materials. So we'll start by talking about Vera Fahlberg's model of attachment. This is called the arousal relaxation cycle. So the arousal relaxation cycle, think of this in terms of infants at this point. So you have a baby. They experience a need. They're hungry, they need their diaper changed, whatever. They experience displeasure. What happens then? How do they then voice their displeasure? They cry, right? You know. So we change their diaper, we feed them, we rock them, we meet whatever their need is. Satisfaction of need. Then they enter a period of quiescence. That's the period when they're quiet and they're comfortable and they feel good about things. And they stay there until they experience a need again, and then the cycle repeats itself. So this cycle then, repeated many times, is the thing that reinforces for the child that this world is a safe place and that they can trust that their needs will be met. So that means a couple of things. It means that it's also important for them to experience the displeasure and feel hungry or feel wet, and because that's the only way that they can know that when they express a need, somebody will respond to them. But then it's important that they can then depend upon the fact that someone will indeed always respond in a consistent way. And beyond that, it's important that they be able to identify that there is a primary person in their life that will be the person that responds. Now, this period of quiescence after the satisfaction of the need is the place where attachment happens. So, we've changed the baby, we've fed them, we're rocking them. We're making eye contact with them, we're talking to them, we're cooing. That's the place where the attachment is happening. Now think about this with older children. And think about Vera Fahlberg's work with helping older children who are being adopted attach in their families. So then it becomes about taking advantage of attachable moments. And the need and the displeasure for an older child isn't going to be because they're wet and hungry, probably. I mean, they still get hungry, I guess. And I suppose they still get wet, but that's another story. And consistently being able to come and meet their needs, which may not now be physical needs, but may be emotional needs, right? Then allows you to take advantage of that time after the need is satisfied. So let's stick with the physical thing as kind of an example, because that's just more concrete. So let's say, we have a child, they're riding their bicycle, they fall down, they skin their knee, they cry. We come out and say, oh no, look what happened, you fell off your bike. And we take them in and we clean it up and we put a SpongeBob Band-Aid on it, and then they feel all better, right? That period then after SpongeBob is the period where the attachment can happen. Take advantage of that moment. Now see, with my children, I would have said, all right, you're better now, go back out and play, And that's not a bad thing, right? But that's the time when you can talk a little bit about the child. Maybe help them put some words to what they're feeling, right? Sit with them for a moment. Soothe their emotional needs as well as just their physical needs. That's the place to make that attachment happen. So that's how the arousal relaxation cycle happens. Think of it in terms of infants. Think of it in terms of how that can be used with older children, where it's not quite as concrete or not quite as obvious. This page that I'm giving you comes off of the DSHS website. It comes from the Early Childhood DCEL, that's the child care licensing. They're now going to be a department all by themselves. But they have a project, I guess you would call it, that they call BrainNet. And they do a lot of things since we discovered the importance of early brain development. They do a lot of things that are related to, that may be useful information for child care providers that are related to that. So I want you to look at this on the second page. I like this article because it has this nice little chart to it. And this then tells us when the window of opportunity is open for these various things to happen. And we'll talk more in detail about the brain development later. But look down, the second one from the bottom says social attachment. And look at the time frames here. It goes from birth to a little under 2 years, right? So those first 18 months or so are the critical times for attachment. That's when a child is learning about this cycle. And it's being reinforced over and over again when their needs are met and someone comes and takes care of them, that the world is a safe place to be. When that window closes, somewhere between 2 and 3, maybe earlier, it can be really difficult to come back and reopen that window for kids then to learn to attach. What they learn about the safety of the world in that first 18 months or so is absolutely critical. Absolutely critical. They need to learn that this works. Some of you may be familiar with Erik Erikson. Does anyone know the name Erik Erikson? He was one of the early psychologists. He actually was like a colleague of Freud. I think he took a slightly different approach to things. But he developed this model of human development that identified all of these various life stages. And he said each of these stages has a time of special ascendancy, were the words that he used. Special ascendancy. And that meant the same thing as what we're just saying. But, he was way back like a long time ago. How did he know this stuff? He didn't know about brain development. But what he learned from studying people is that there was a particular time over the life cycle, particularly during the cycle of a child, when it was the right moment for things to happen. And he talked about that very first stage birth to 12 months being the stage for trust to develop. Well, guess what? That's what we see in this model as well, right? It's the same thing. And what we know now is it isn't just Erik Erikson saying this, and it isn't just Vera Fahlberg saying this, but now we have scientific proof that there are physical changes happening in the brain when these things happen at the right moment, during that window of opportunity, during that time of special ascendancy. So it's really, really important.
So later on in life, like holding therapy and all these things, is there any kind of study that period of time that because of domestic violence or whatever, that child did not get the security, it was not diaper changed and so on, and later on in life, could you ever replace that?
You know, that's a hard question, and I think that we don't necessarily know the answer to that. I think the answer to that right now is a modified no. We know that that window of opportunity exists. We know that it's very difficult to reopen that window once it has closed. But I don't think any of us are in this business to give up on kids because their window of opportunity is closed, right? And so I have a couple of things to say about that. Now, again, this is part of this, at least, is the world according to Dinah, you know, which means that, you know, I'm not talking from any scientific study. I'm talking, you know, from my own experience. But another part of it certainly has increasing scientific evidence behind it. Just right now, there is a whole new piece of information that kids, when they get to be about 14, a whole new window of opportunity opens up for some of these things that were closed off in the past. Not the same as the window of opportunity when they were 6 months old, because it's a little more about abstract thought and making conscious decisions and all of that, but that we've just discovered that all of this growth in our brain, just as it did when we were born, suddenly explodes again when we're about 14.
Isn't that the frontal lobe drive? That's why we should let kids drive under a certain age.
Right. So I think that that's really good news. The other thing, let me think of it this way. Think about language. That's a really concrete thing. You know, attachment is a little more nebulous, but let's talk about language. A child is born able to hear all of the sounds of every language on earth, right? They hear all those sounds. By the time they're 16 months old, they have lost the ability to hear some of the sounds that are not in the language that they hear spoken around them every day. We know they can't hear that difference. You know, I mean, we hear, I mean, we hear sometimes about how in the Asian languages they don't have R's and L's, and so Asian people who are trying to learn English have a difficult time distinguishing between the sound of the R and the L. That's what that is. They literally can't hear the difference because those sounds are not in their first language. But all of us can learn a second language, right? If we learn that because it's spoken in our homes up to like about age 7, then it just comes to us naturally, right? It just comes to us naturally. We learn it naturally. We don't, you know, we think in 2 languages. It's effortless. But when we learn a second language later, we literally have to learn it, right? Any of you who've taken a second language, remember, you know, when you studied Spanish, that your teacher said, okay, to make this sound, you need to put your tongue in this part of your mouth. Now let's all practice together, you know, whatever. Have you had that experience? You've seen that? So what our brain was open to and did automatically before, now we have to learn consciously. We have to be taught where to put our tongue in our mouth and all of that. And I think that the theory is that it's impossible to learn a second language without an accent if you learn it like after age 7 or something like that. And it's for that very reason, because you don't hear those sounds in the same way.
So how I am doing? Can you tell that I have an accent?
Yes.
Oh, yes. Are you from Deutschland?
Yeah. Yeah, we knew that, but we don't have any trouble understanding it.
Good.
No. But you know, can you understand that? I mean, that makes sense, right? Okay, now translate that to the less tangible things like attachment or caring or responsibility, or even one of the things that we get hardwired for is calming behavior, you know, the ability to just sort of calm ourselves. And that can either come to us naturally during that window of opportunity, wherever it happens to be on here, or we can make a conscious effort to learn it. It's harder that way, isn't it? Dang, we just need to all learn it when it comes naturally. But kids who are around 14 are able then, they have this huge growth spurt in their brain, and they're able to start thinking, this is not what I want for my future. I want to do things differently. These people that I'm living with really care about me, and I want to treat them better. They can do a lot of things to say, I want to be able to go on and have a happy, stable life and have a family and, you know, do meaningful work and et cetera, et cetera, et cetera. So that's my view of that, is that even if they miss the window of opportunity, that there are other ways, perhaps, of helping kids overcome some of those early deficits. But it may be professional help that's needed to do that. And kids will recover to varying degrees, you know, and some don't recover very well. I mean, this whole attachment piece, I think, is just one of the most important things. I mean, it impacts everything about how we live our lives. You know, human beings are social animals. You know, we operate in a culture, in a social environment. And as parents, well, I guess what I want to say is the thing that allows us as parents to impact children's behavior is the ability of that child to attach, because that means that they care about the environment, they can predict the things in their environment. It's all based on relationship. Without relationship, there's no motivation for a child to follow the rules or, you know, fit into a family or any of those things. So, you know, I mean, it's sort of scary. I mean, you've probably had this experience where you just thought, I don't know what to do with this kid because he doesn't care. He doesn't care if I do this. He doesn't care if I, you know, discipline him. He doesn't care about following the rules. He doesn't care about the other kids in the home, right? And it's a little difficult for us to do anything with a kid who doesn't care. Okay, we're going to take a few minutes now, and I'm going to pass out to you a scenario about a 2.5-year-old named Danny. So read this, and then with your neighbor, pair up with somebody, and spend a few minutes just talking about this with your partner. And as you read Danny and discuss with your neighbor, I want you to think about the things in the story that you're reading that indicate signs of attachment between Danny and his mother, and then separately, Danny and his father. Okay? So let's take about 10 minutes for you to read and discuss that. There are two ways to look at this scenario. First of all, we've been talking just generically about how attachment happens. And the reality is that if a child has the capability to attach, then they have the capability to reattach. It's that capability that's the important thing, right? So we need to make sure that when kids are babies, that they learn this cycle so that they have the capability to attach. This scenario, though, is talking not only about those generic signs of attachment, but it's talking about us looking at the relationship, at the attachment that Danny has with his father and that he has with his mother. Because having the ability to attach does not necessarily mean that he has the same attachment to both people, right? So we do this to help us kind of see the differences and to recognize all of those things that do indeed show that Danny, as the child, has the ability to attach. So tell me what kind of things you found. What did you find that were signs of attachment between Danny and his mother?
I didn't really.
You didn't?
Well, he ran to her and put his arms up when she came.
Yeah,
At the very end.
So he didn't find.
right. I didn't see besides his mother.
Yeah, yeah. But we have some recognition that he did go to her and hold up his arms, right? So there's some affection there, some kind of a bond there. Anything else that you saw?
And Tammy was the one who called the social worker, so that motherly instinct of there's something wrong, he got beaten or something. She did this initial
remember,
call.
I have this now.
She did this. Tammy did the initial call to the social worker, so that motherly instinct of protection probably was there for a short while.
Yeah. You know, I tend to think that too, but there's another part in this scenario that said she did that even though she knew that he was likely to be removed. You have a comment about that?
I think they were already having problems, and when she reported him, that was also a way out since he was already failing to thrive in the hospital. Why did that happen? He was eating okay and gaining weight okay in the hospital, but yet not at home. So there was maybe possibility of neglect there where he was already, starting to get abused.
There's two ways of looking at that, isn't there?
The other is she probably reported him knowing he would be removed. The parents are planning a divorce, and down further she sees him as deliberately wetting his pants. That there's definitely, she's taking it personally that he did that just to get
Right.
back at her, and so
And she doesn't have age-appropriate expectations of him.
right, and that by knowing he's going to go into foster care and that they're planning on getting a divorce, it's her way of getting the child out of the home.
Maybe. Well, we don't know that. I mean, it's a good thing that she was willing to
Make the report.
to report, right? What was her motivation for doing that? Well, we may not know, but we need to not assume either.
She also wasn't able to give enough information about how he interacted, how he played. I mean, moms know how kids play and what they like to do, even when they're little babies. They know the self-soothing, whether they suck their thumb or they have their blanket or their binky, whatever. She didn't know that.
That's, I think, a really important one. That's one of the real signs around attachment is being, it's called a dance even, It's like we know our child, we know the rhythms, we know their likes, we know their dislikes, we know how to make them more comfortable.
Their sleep
It's-
patterns,
yeah,
and their
there's
eating
all-
habits, and when they bathe, and when they sleep, and when they
Right.
nap, all that stuff.
Yeah.
She failed to give that information.
Yeah.
She did say, though, however, she did say that he was easygoing and affectionate,
Yes.
so I don't know how she would know that unless she was actually watching him and able to, you know, to where it kind of goes against each other. It doesn't.
Well, you know, nothing is, it's not all black and white. It's all in those shades of gray, you know, that's the hard part.
And then the other fact is he was a premature baby with a cleft palate, and for maybe first-time mom or dad, it's totally different to take care of a special needs child.
Yes.
So it could easily be that, you know, because of the cleft palate, maybe he got a feeding tube in the hospital, and because of that, more knowledge of how to feed a child with cleft palate, and that's why he gained weight.
Right. And I think you make a really important point, because remembering that cycle of attachment, one of the situations that can interfere with a child forming a secure attachment is, first of all, that early hospitalization where they're in that institutional setting and don't have, like, their one primary caregiver responding to their needs on a regular basis. That can be one thing. The other thing is a child who is in the hospital, who has an illness, whatever, may not be able to complete this cycle, may not be able to have their pain alleviated by their parent showing up. You know, often, you know, children with a serious illness as an infant, they have to go through lots of painful procedures, you know, variety of things. This child probably wasn't able to do the normal kinds of feeding things that contribute to attachment. That may have interfered with that. He probably had a surgery, I would assume. So there, you know, were painful things going on. Things were not normal. That whole cycle had some disruption to it that was impossible to avoid. Did you have a comment?
Yeah, just having cared for a preemie, they're very time-consuming, and I got a 5-pound preemie. He was 7 weeks old when they discharged him from the hospital, and I must say I had forgotten how much time they require. And I mean, he fed on a 2-hour schedule initially, and he was just a little bag of bones when I got him, and he'd had multiple caretakers for his first 7 weeks in the hospital.
Yeah.
But once got him home and, you know, was able to feed him on a regular schedule and be a consistent caregiver, he gained weight very fast and was definitely not a failure to thrive. But to look at him when I first got him, it was amazing.
Yeah.
That takes time.
And it takes an amazing amount of time, and I can see if this mom is very young and he had a cleft palate, so he wasn't the, quote, perfect baby, she probably had a very hard time bonding with him.
Yeah.
And she was probably sleep deprived, because I know I was.
Yeah. Could be.
Which leads to other issues. She aged at least 10 years.
Is that right? Okay. Okay. So we see some things with mom that are positive. We see some things with mom that are negative, right? What do you see with dad?
Well, what on earth is somebody spanking with a belt a 2.5-year-old? That just blows me away. That dad would do something like that.
Yeah, that's probably not appropriate parenting.
It
right?
certainly isn't.
Yeah.
But then on the other hand, he seemed to be more caring about him. He knows about the likes and dislikes, and he plays with Danny in the nursery, and seemed to have, despite the fact that he was abusing him, a nurturing kind of relationship, and Danny even imitates him when he does his thumbs up. Definitely this father needs some parenting skills.
Yeah, now the imitating, I think that's a really important one that shows that link. And we had a couple of demonstrations of that We had Danny trying to walk like his dad, putting his fingers, wasn't there a thing about him putting his fingers in his pockets? And we had him putting his dad's glasses on. You know, all of those things are some of those characteristics that you will see in attachments, you know, the imitation, that development of sort of rituals, games with children, you know, the things that they do, those are all signs of attachment.
And the father also had the empathy of when he left the nursery, he left his coat behind, making, you know, giving him the sense of security that, you know, I'll be right back.
Yeah,
That was an important one.
that was a good one. Did you have?
That's what I was
Oh, you were going to say that one too?
He also understood his speech, whereas a lot of the other people didn't. So
I know he spent more time with him, I
he
think, than his
spent
mother.
quite a bit more time
Yeah.
with him than the mother did. Quality time.
Yeah, I think that's really an important one too. You know, being able to understand them. I mean, you've probably all experienced that. It's like, what did he say? Oh, well, this is what he said. You know, the parent can understand it, but no one else in the world
Take a lot of time.
can. Yeah, yeah. So who do you think he's more attached to, his mother or his father?
I think his father.
His father? Yeah, almost exclusively people come to that agreement. And it's interesting because initially going in, I mean, it was the injury that the dad inflicted that brought this to the attention of the system.
So it's weird, like, where would they go?
That's right, to be able to look at this and see that in terms of where this child
They're gonna
will
give it to her
grow
or
up,
him, yeah.
where really is the best fit? Where does the attachment lie? Yeah. So what did you see in looking at this? Let's look at the more generic view then. What did you see that you recognize as signs of attachment, whether it's to the mother or to the father?
Quality time, listening, reassuring, I'm coming back, holding, comforting.
Okay. Those are things that, the behaviors that the dad did that show that.
I think also that the child was easily distracted following their departure. So he felt like that they are coming back and I'm going to be safe with these people that they've left me with. I have seen children that aren't attached and they go and they scream and they scream and they scream because they can't be distracted away from the primary caregiver.
Very important point. Very important point. And in some ways kind of counterintuitive. I think people who don't really understand this whole process of attachment think, oh, well, look at that child. They're like stuck to their parent. They must be really, like literally, attached to them. But the reality is that what attachment is about is having a secure base from which to go out and explore the world. So kids that, now remembering that there certainly are developmental stages where, you know, there's reaction to strangers and all that, you know. I mean, every child goes through that. But in terms of persistent characteristics, kids who are clingy and are afraid to let go of their parent, who become rather overwhelmed when their parent leaves the room, those things are not indicators that the child is attached securely. They are indicators of an insecure attachment. Because the child hasn't learned, just as you said, that the world is a safe and secure place, and I can trust that if I go out and explore the world, I can come back and there will be someone there for me who cares about me and meets my needs. And all of you know, all of you have seen it in child development, how that happens, where, you start with this infant and then they start getting pretty adventurous after they get their little feet under them, right? And 2-year-olds are known for their independence. 2 years old is where they find out that they really are separate beings and that there's this 2-letter word that starts with an N, which word I'm talking about, right? Well, they can do that because they're exerting their independence. So that's an important distinction about attachment.
So can they regress?
Yes. But now say more, because I'm not sure I'm answering the right question.
So can they attach, like let's say they're attached to the foster parents, they've got that attached, the bonding. Can they go back into a period where they feel insecure and they cling to you and they don't want to let you go?
Don't we all? I mean, isn't that true?
It's
you know,
true. I mean,
it's like just because we have the capacity doesn't mean that we're going to do it at this moment in time. I mean, we may be going through a situational thing where, you know, we feel like we've been betrayed or the world doesn't feel safe. But if the capacity is there, we will find it again. You know, but sometimes we do indeed see kids that we've seen attached who go through because something has disrupted their lives, who go through a period where, you know, it just seems like it's really difficult for them to get in touch with anything.